The table can be operated by either AC 120 volt power or battery operation. For AC power operation, be sure the power cord is securely attached to the table. Plug the other end of the power cord into an approved hospital-grade electrical outlet. Next, activate the power switch to the on position, which should illuminate. The pendant control buttons and power indicator light should also illuminate. For battery operation, make sure the main power switch on the base of the surgical table is off. The electrical power cord should also be unplugged from the outlet before unplugging the cord from the table base. To initiate battery power, press the battery button on the hand control. The button should illuminate, as should a red battery indicator light in the upper right-hand corner. The battery indicator light on the table's base will illuminate, indicating the amount of battery life remaining. A fully charged battery will last approximately 2 weeks under normal operating conditions. The battery indicator light flashes if battery life is running low. It is recommended that the battery be charged at the end of each week to establish a normal and routine protocol. The following are some additional safety measures that will ensure safe operation of the table. To maximize patient safety, always utilize proper restraint methods during extreme Trendelenburg or lateral tilt positioning. The leg section may hit the table base or the floor if both the leg and elevation systems are placed in their full down position. Exercise caution. The table is equipped with a safety interlock system that prevents table movement that may injure a patient, such as raising the back section while the kidney section is also raised. A beeping sound indicates this occurrence. The interlock system can be overridden when the emergency backup control switches are used. Although thick pads and sheets substantially protect the patient, pinch points do exist and are necessary to provide for the variety of articulations required for surgical procedures. These pinch points are located on the top section between table joints. Be sure that arms, hands, and fingers of the patient, as well as operating room personnel, are clear of all moving parts before moving the table. If emergency circumstances demand that table brakes be unlocked, the patient must first be centered and evenly distributed on the tabletop with the table lowered to its lowest height position. The tabletop must be in normal orientation with back and head section over the base of the surgical table. Prior to unlocking brakes, check for obstructions on the floor that might prevent the table from moving smoothly to a new location. Relock the brakes immediately once the final position is reached and before commencing surgery. If the patient exceeds 250 pounds, 4 operating room personnel should assist in moving the table. If the patient exceeds 500 pounds, brakes should remain locked at all times. Properly following the cleaning guidelines for the Hercules 6700 series surgical table helps to ensure its functionality and safety throughout the life of the product. Thoroughly read and follow the manufacturer's directions for all cleaning fluids. Do not use cleaners containing phenolics. Never spray cleaning agents directly into electrical receptacles or microswitches. Before replacing pads on the table, make sure the pads and all matting surfaces are completely dry. Moisture trapped between the pads and matting surfaces can cause distortion of tabletops. When the cleaning procedure is complete, replace all pads and accessories as applicable. There are a number of table accessories that are designed to make certain procedures safer and more efficient. When installing or removing any Skytron accessory, the surgical table should be level and at waist height. Certain accessories used with the table may limit weight capacity. Defer to the lowest weight capacity rating when using accessories. Contact your Skytron representative for more information on these and many other table accessories. For specific details on selected Skytron table accessories, please refer to the Surgical Table Accessories section of this DVD. As you have now seen, the Hercules 6700 series table is a powerful, well-designed, and quality general-purpose and bariatric surgical table, which has been engineered to deliver years of reliable, trouble-free performance in the operating room. Observing all safety, operational, and patient positioning guidelines outlined in this video, as well as performing routine preventative maintenance, will ensure years of optimum performance and reliability. We thank you for choosing the Skytron Hercules 6700 series surgical table for your clinical needs.